All right, let's jump right in. We're going to take a look at a really fascinating idea, a critique of public health in a place you might think has it all figured out, Hong Kong. And we're going to see it through the eyes of someone who's, well, thinking way outside the box and trying to build, quite literally, a bridge to a healthier city.
And it all kicks off with this really simple but kind of profound question. You know how we always see those headlines, the ones celebrating places where people live the longest? We just automatically think, wow, they must be the healthiest people on Earth. But is that really true? Let's dig into that a little bit.
And that question leads us straight to this huge paradox in Hong Kong. See, on one hand, people there live for an incredibly long time. I mean, they're at the top of the global charts. But, and this is a big but, if you actually look closer, you start to wonder if living a long life is the same thing as living a healthy life. They might not be the same thing at all.
So, what's the secret sauce? How are they living so long? Well, it turns out it's not really about everyone having amazing, healthy habits. The key, the really big thing, is that Hong Kong has an absolutely world-class emergency system. They are fantastic at saving you when something goes wrong. But see, that's a reactive model, right? It's all about fixing problems after they've already happened.
Okay, so now let's meet the person who's looking at this whole setup and saying, wait a minute, is this really working? He's a doctor, sure, but he sees himself as something much bigger and honestly way more interesting. So professionally, he's a pediatrician. His whole world is about giving kids the best possible start in life. But he started to realize that real health, it isn't just about checkups and medicine. It's about the actual world these kids are growing up in.
And get this, he also calls himself a cyclist. And this isn't just some weekend hobby. It's fundamental to who he is. It completely changes how he looks at a city, how he sees people moving around or not moving around.
But here's the kicker. The most important thing he calls himself? A bridge builder. And he doesn't just mean that in some symbolic, metaphorical way. No, he means it literally. He's actively trying to get the government to build actual, physical bridges for people.
And this quote really sums up his whole philosophy. He says that when you just stick to your professional label, you're kind of putting yourself in a box. You're monopolizing knowledge. By stepping outside of that doctor box, he can see the much bigger picture of what actually makes a community healthy.
All right, so let's zoom out and look at that bigger picture he's talking about. We're going to dive into this hidden crisis that's quietly simmering inside what's known as a super-aging society. It's a place where people are surviving, for sure, but maybe they're not really thriving.
This chart here really lays out the challenge perfectly. Look, the group of people over 85, that size is staying pretty stable, but it's this huge group, the 65 to 84-year-olds, that is just exploding in size. This is the absolute critical group where we can actually make a huge difference.
And for this group, the goal is super simple, but it's so important. Just stay as healthy as possible for as long as possible. You know that saying, add life to years, not just years to life? That's exactly it. And one of the absolute best ways to do that? Exercise. Plain and simple. But, just being physically active, that's only one piece of the puzzle. There's this other massive challenge, and it's mostly invisible. This number it's just staggering. Data is showing that 1 in every 2 people will deal with a major mental health issue at some point in their life. Just let that sink in for a second. Half of us.
And when you dig into the details, you see these specific crises just bubbling under the surface. We talk a lot about cancer, right? But in terms of just devastating your quality of life and even leading to suicide, depression is actually the #1 killer. And at the exact same time, experts are warning about a literal tsunami of dementia on the horizon. And the craziest part? The resources we put into mental health don't even come close to matching the size of the problem. It all feeds into this growing epidemic of loneliness. It's so bad, people are starting to call it the next pandemic.
So that makes you wonder, right? What is going on here? Why aren't people in this city of long lives exercising more or connecting more? This brings us to the core idea, what our pediatrician friend calls the infrastructure trap. It's this theory that our environment, our surroundings, are what really shape our health.
Here's the key takeaway. It's called the infrastructure behavior link. The whole idea is that we don't make choices in a bubble. Our everyday habits, our behaviors, they're pretty much dictated by the world around us. Think about it. If it's easy and safe to go for a walk, you probably will. If it's not, you probably won't. Simple as that.
And that right there is the heart of the problem in Hong Kong. The reason more people aren't getting out and exercising, it's not that they're lazy or unmotivated. It's a lack of infrastructure. There just aren't enough safe, easy to get to, and frankly, pleasant places for people to just be active.
Okay, so if the way the city is built is the problem, that also means it can be the solution. This isn't about just complaining about how things are. It's about actually rolling up our sleeves and building a better future. So let's take a look at what that vision for a truly healthy city might be.
And the big mind shift we need to make is right here. You see, real health isn't created in a hospital. It's not made in an operating room. It's built out in our neighborhoods, in our parks, on our streets. The answer is out there, in the community.
This really lays out the roadmap for a whole new way of thinking about public health. First, we got to redefine what health even means. It's not just about the absence of sickness, right? It's about total well-being. Second, we have to focus on these things called social determinants of health, like, do you feel connected to your neighbors? Is there green space nearby? And finally, and this is the most important part, we have to actually build the stuff that makes the healthy choice the easy choice.
And that brings us right back to the beginning. This is exactly why a pediatrician who's also a cyclist wants to be a bridge builder. The bridge isn't just a metaphor anymore. It's the literal, concrete solution. It's a piece of infrastructure that's designed for people, not just for cars. It's a space where the community can come together, connect, and just move.
So I'll leave you with this final thought. This whole idea is so much bigger than just Hong Kong. I want you to think about your own city, your own neighborhood. What's the missing piece of the puzzle where you live? What's the bridge, whether it's a real one or just a new idea, that your community needs to build to be truly, deeply healthier?